Today, my talk is on the current trend of breast cancer among Bangladeshi population, snapshot from a single center from mid-2019 to mid-2023. Starting with a brief introduction, we know that breast cancer is a malignant tumor that starts in the cells of the breast. Breast cancer is the most commonly occurring cancer in women and the most common cancer overall. Breast cancer diagnosis changes the life of around 1 in 8 women, making the population risk of around 12.5%. There are two main types of breast cancer. These are ductal cell carcinoma and lobular carcinoma. However, there are some other varieties as well, such as tubular carcinoma, mucinous carcinoma, adenoid cystic, and so on. But the ductal carcinoma is the most prevalent one. Breast cancer does not spare men entirely, who represent around 1% of all the cases of breast cancer. In the last few decades, the incidence rate in Bangladesh has begun to rise in the age group of 40 to 50 years, which is very worrisome. Women often do not present for medical care early enough due to various reasons, such as illiteracy, lack of awareness, financial constraints, and shyness. This study seeks to estimate the frequency of breast cancer in a single center breast care unit led by Dr. S.K. Farid Ahmed, FRCS, and his team that represents the population from all the corners of Bangladesh. Now coming to the materials and methodology. Patients with primary breast cancer from mid-2019 to mid-2023 were identified, and information on tumor biology, grade, nodal status, histopathology, distant metastasis, and treatment were studied retrospectively. Material used here was the patient board website of our mentor, Dr. S.K. Farid Ahmed, which has the documentation of patients' history, examination findings, investigations, and treatment. Now coming to the results and the discussions of this study, we have seen a total of 4,963 patients during this time span of 48 months, where 848 were cancer patients, that is 17.08%. We have seen cancer patients from 18 to 85 years with a median age of 45 years. Now coming to the age variation of the cancer patients we have seen, this is a graphical representation of the age group of the cancer patients, which shows that below 20 years, we have seen 2 cancer patients, both of them were 18 years of age. Between 20 to 30 years, we have seen 39 cancer patients. Between 31 to 40 years, we have seen 158 cancer patients. And here we can see that the vast majority of the patients were between 41 to 50 years, which were numbering 297. So this is really very alarming. Here we can see that more than half of the patients are below the age of 50 years. However, we have also seen elderly patients from 51 to 60 years. There were 211 cancer patients, and more than 60 years, 141 patients. Now coming to the histopathology, we have seen that 97.6%, that is the vast majority of the patients were having invasive ductal carcinoma. Rest of the 2.4% were invasive lobular carcinoma and other varieties of breast cancer. Among the patients with invasive ductal carcinoma, most of the patients were having grade 2 disease on histopathology, followed by grade 3 and grade 1 disease. Now coming to the inflammatory breast cancer, which is a special form of breast cancer, which often mimics the inflammatory breast conditions such as mastitis or cellulitis and often misdiagnosed. So we have seen 109 inflammatory breast cancer patients out of these 848 cancer patients. Among them, the youngest was 23 years and the eldest was 71 years, and almost similar laterality to the right and left. 13 of them were having triple negative breast cancer and inflammatory breast cancer. So here we can see that according to the world data, 0.5 to 2% of all the cases of breast cancer comprises of inflammatory breast cancer. But according to our study, it is 12.85%, which is relatively very high. Now coming to the tumor biology, out of these 848 patients, data on immunohistochemistry was found in 804 patients. The rest of the 44 patients did not come for further follow-up, so information on tumor biology was not known. 142 out of 804 patients had triple negative breast cancer, that is ER, PR, and HER2 status negative, which is high compared to the worldwide incidence. 621 out of 804 patients had ER positive, that is 77.3%. Only HER2 positive was found individually in 18.98% patients. We know that HER2 positive tumors are quite aggressive and they tend to spread fast and metastasize and tends to recur back early. So here, the percentage shows that only HER2 positive was found in 18.98%, which is really very high and worrisome. 284 patients received neoadjuvant chemotherapy. Now, concluding with the summarization, there is an increasing trend of incidence of breast cancer in Bangladesh, and the young patients are not spared. In fact, we have seen that around 23% of the cancer patients we have seen during this time span are under the age of 40 years, and more than half are under the age of 50 years. So this is very alarming. And if we need to pick up this age group, we need to start early mammographic screening. So mammographic screening should be started from 35 years onwards on an yearly basis so that we can diagnose the breast cancer at an early stage, even when it is not palpable. Clinical screening is of less value for us because when the lump is palpable, it's already too late. So we should start surveillance and screening with mammogram. And cases like inflammatory breast cancer, TNBC, and aggressive forms are also too high and needs further studies. Is it because of the environment we are living in or the westernization, or also we have seen that there is a huge chunk of people having hormone-positive cancer. So is it due to the widespread availability of oral contraceptive drugs, or we need to study that further? Our focus should be creating greater awareness, mammographic screening, early diagnosis, and adequate treatment, which will have an impact on the survival and the greater quality of lives. Thank you so much for kind hearing.